Hi, my name is Allie Taylor. I'm a student nurse. I'm going to be doing an assessment on your baby today. Before I get started, I'm going to check the patient identifiers and make sure I have the right baby, and I do. Before I start messing with him, I'm going to go ahead and listen first and get his apical pulse and respirations. I'm going to listen bilaterally for a minute and also take the pulse for a minute. While I'm down here, I'm going to go ahead and listen to his bowel sounds. Alrighty. And normal infant vitals should be 97.5 to 99 for temperature, 100 to 160 for pulse, and for respirations it should be 30 to 60. I'm going to start with his head, and I'm going to check it for molding. I'm going to check the fontanelles to see if they are bulging. They should be nice and flat. And I'm also going to check for caput succedaneum, which is fluid that would cross the suture lines and be over his whole head, or cephalohematoma, which would be blood filled just on one side, does not cross the suture lines, and everything looks good. Next, I'm going to move down to his eyes and note that they are symmetrical and midline. I'm going to check for any kind of discharge or hemorrhage, and I'm also going to note the epicanthal folds. Next, I'm going to move down to his ears and make sure they are in line with his eyes. I'm going to check the recoil by holding it down gently and letting go. Next, his nose. I'm going to check patency of his nares by holding one closed and feeling under it, under the opposite one, and then vice versa. Then I'm going to put on gloves before I move down to his mouth. I'm going to put my finger on his cheek, that way he opens his mouth, and I'm going to feel the top of his palate and make sure it's closed and formed. I'm also going to check that he has a sucking reflex when I have my finger in his mouth. Next, I'm going to move down to his neck and feel for any masses and check range of motion gently. And then I'm going to check his clavicles, feeling for any masses or anything that feels like a break. Sometimes they break during delivery. I'm also going to check his skin color while I've got his blanket opened up. It should be pink. There shouldn't be, I'm going to note any peeling, rashes, whether or not he has lanugo, vernix. And I'm also going to check his umbilical cord while I have his blanket open. It should be drying. There should be no signs of infection. While I'm looking at his chest, I'm also going to note to see if there's any signs of respiratory distress, which would be grunting, seesaw breathing, nasal flaring, apnea greater than 20 seconds, or retractions. Next, I'm going to check his muscle tone by holding his arms up, bringing them back down, and when I let go, they should go back up. Moving on, with my gloves still on, I'm going to go ahead and check the baby's genitals. This baby's a boy. I would note the rugae on his testes. I would palpate to see if they were distended or not, and I would note whether or not he's circumcised and check the dressing if he was. If I had a female baby, I would check her genitals. Her labia majora should be a little swollen, edematous, darker pigmentation, and I would note any discharge that she had. This baby looks good. I'm going to go ahead and flip the baby over to check his spine. And I would also check the top of his buttocks to see if there is any dimple or tuft of hair that could be indicative of spina bifida. Next, I am going to move down to his feet, where I would check the Babinski reflex by running my finger or the edge of a reflex hammer up his foot. His toes should flare. I'd also note the number of toes, the number of fingers, and any creasing in his hands. During the assessment, I would be assessing the baby's behavior, whether or not he's crying and how he's acting and how he's moving. I would also hit the table or do something to startle the baby. His arms should go up in like a C, and that's the Moro reflex. And then before I'm done with the assessment, I would talk to mom and see when his last bowel movement was, when he last voided, when his next feeding is, and if she needs any help, address that at that time. And that is my baby assessment.